There, go.
All right, welcome back, folks, to Free My Pain Now with Dr. Matt Doduro. And this week we have Maria Crawford. And Maria is a nurse practitioner in Tucson, Arizona, and just a phenomenal provider. We really love what you guys are doing in Tucson. She also is one of our TRT Centers of Excellence and is doing a wide variety of different healthcare for their community. So one of the things we're bringing Maria on as our expert is we want to learn more about this antibody test that everybody's talking about. And you're going to help decipher for our viewers and listeners what's going on. So Maria, thank you so much for being available, and tell us a little bit. Take it away.
Yeah, absolutely. Thank you. Thank you so much for bringing me on and letting me do this. I have been trying to be really prudent through all of this to stay on top of what is the latest and greatest everything COVID, so that I can inform my patients and keep everybody calm when they don't need to be too excited, and to make sure that everybody is protected the best way they can be. And I have been watching the different types of tests that are available on the market, and I know there's been a lot of bad testing out there. And of course, we're doing all this in as fast as we can, right? And so you want to make sure that even in trying to be fast, that we still have a very specific and a very sensitive test, and looking at for the most appropriate things. So let me talk to you guys about antibody testing, and why this is important too is because this is, as we start to look to get people back to work and to start getting the economy going again, antibody testing, and I'll show it to you why this is going to be a way to kind of help us navigate that. So I'm going to share my screen with you. I prepared this small PowerPoint presentation just so you guys can you see my screen?
Yes, we can.
Okay, just want to make sure. So I just wanted, it's much easier to explain this way, and you guys, I love visuals, so this is why you get this. So currently, this is the United States, these are our cases. You can see that we're actually starting to trend down as we are really kind of have passed our peak. And this is as you know, yesterday's news is old news. So we've already passed this point, it's the 21st here. Although there are certain states like Massachusetts that are still rising, they have not hit their peak yet. Luckily here in Arizona, we have, and we're really looking forward to getting people back to where they should be. So current testing right now that's going on, this is the nasal swab that you have been seeing on the market. This is for kind of rapid test or 48-hour turnaround. And this is what's called a reverse transcriptase, big long word, polymerase chain reaction. And what that means is it's really looking for the actual viral RNA in the body so that there's evidence of the virus in the body. That doesn't tell us anything about antibodies at all. So this is a really fun slide because I'm going to tell you about this reverse polymerase.
Maria, hold on one second.
Go
We
ahead.
got some of your emails. If you could just make that screen wide again. You're sharing part of your...
You can only see half of this?
Yeah, maybe, let me see, let me just make sure that's okay. Okay, sorry, you're good.
Okay.
Keep going,
Okay. I was like, wait, I see something very, very different. Okay, so this is the current testing, and this is how it works. So right here, you can see that it's looking for it's extracting the RNA to DNA. And this is where we can start to have problems with the tests on the market, because as they do this, they have to mix different primers, they have to heat it up, and it's a multi-layer process. And anywhere in this process, if anything goes wrong, you can get actually a false negative. And this will start to lower the sensitivity of the test. So currently right now, there's I'll show you on my next slide how high the level of false negatives there is going on. But we really have to have the correct reagents, and we've been having a shortage of reagents, so that's why our testing didn't get out as fast as it should have. And then the time, it can take anywhere from, currently now it's like 15 minutes, but it also can be 2 days. So there's a lot of variation there. So I'll show you why we're having problems with these swabs is really because they're improperly swabbing the patient, where they're actually getting the swab back, how far they're getting it back. And then it's notoriously inaccurate because of the storing and the transportation. And it really has only about a 63% accuracy rate for it. And that's after someone's been infected for 14 days. You don't, it's for the first 14 days. After that, you don't know if they've had it or not by using this test. So this is kind of where this whole antibody testing comes in. So this is the fun stuff. So I'm going to take you guys back to some of your biology classes, and you may start to want to snooze here, but this is actually fun. So, or just the geekiness in me finds it fun. So this is the pathogen that comes in the body right here, and a macrophage is what actually eats the virus. So when the macrophage eats the virus, then it starts to create an antigen complex. And you see this little marker right here? So that sits out and it acts like a little receptor, a little signal. And that will actually present to the T helper cell. So that guy will help us make the activated B cell and then make plasma. And this is ultimately where your memory cells are made. So when you have an antibody to something and you're not going to get it again, that plasma cell is what actually makes it. So this is important for us, remembering these antigens as I talk about this test. Is this as clear as mud for you, Matt?
I love it. It's
Okay.
10th grade biology. I remember it now. I love
Perfect. It's all coming back. So this is considered the innate immune response. So frontline, very first thing that happens is IgM antibodies. And this happens when it starts to present to the B cell. And this is within like the first 3 to 5 days, this starts to occur when someone is infected. So this is a very beginning of an infection. I won't get too much into the nitty gritty of this, but this is really this is only supposed to last on the beginning end of an infection, but not the end of the infection.
So when you were talking about that last screen, was that a period of as well when they could be contagious?
Correct.
Also?
Yeah. So when the IgM is still present, you actually can be possibly, so this is where our research is getting better and better. When the IgM is positive, you could possibly still be shedding the virus because you're still young in your sickness. You haven't converted completely over to just straight IgG memory cells. So that's the thinking is, when is it safe to send someone back to work? And if you have IgM positive, is it really safe to send you back to work, especially if you're working in an older folks care home? Which I have a sample of that to show you that exact scenario. So this activates a complement, which is basically this kind of brigade. So you can think of like a big army, and you have the general at the front lines, and he basically says, come in, and come kill. That's what complement is. And so it signifies the natural killer cells to come to that area and help kill off what's going on. So this is really COVID specific. So this was a study that came out of China that looked at 67 patients that were diagnosed with COVID and through the nasopharyngeal swabs. And they did a colloidal base. It's a different type of measuring. They put it more on this glass, and they were just looking for IgM antibodies. And they were seeing 11% of them would see those within the first 1 to 7 days, and then 78% of the patients within 8 to 14 days. And then this is what's fun about this infection is that 74% still 15 days past due. And in my practice, I'm even seeing them 6 weeks out with still IgM elevated. So that's
So again, IgM is showing there's an active fight going on within your body.
And it's
right?
new in the infection, correct? Yeah. So vibrant samples, what they're showing here is basically they test for 4 antigens. And if you remember on the little macrophage, those little receptor signals, that's what they're looking for at 4 different areas. And this is really important. So they're showing 93% sensitive for IgM on 340 samples. That's a really great sensitivity rate. So then they look at IgG. Now I think of IgG as gone. G means gone, in the past. So this is where you have a memory. And these are ones that are the most abundant in your blood. They make up 75% of the total immunoglobulins and antibodies that you have floating around at a given time. They're stored in your spleen. That's why your spleen is so important. So there's 4 subtypes of the IgG. And then they initiate what's called phagocytosis. This is a big word, but all it means is the cell eating up or engulfing the target cell. So if it has that little receptor on it, it's going to grab it. And that's what that's for. So we take, this also activates more natural killer cells to target those areas and then neutralize those cells. They're basically the venom. We like venom, right?
Oh, yeah, awesome. I mean, you're out in Arizona. You have to deal with that all the time.
Oh my gosh, and I even ran into a snake on Saturday.
I saw that.
Huge rattle. It was like this big. Oh, okay. I even though I live here, I still don't like snakes.
I hear you.
So viral shedding, this is what we just kind of talked about, of this possibility of someone still being able to shed. And what they're showing is that as the IgG levels, the IgM fall, the IgG rise, we should have less viral shedding. But this is, I think, the area where there's still more research that needs to be done to give us these exact minutia details of when you're not shedding anymore.
And shedding might mean contagious, correct?
Correct. Like I'm still able to give it to you. So.
And so, quick synopsis of that.
Yeah.
Could it be anywhere from 5 to 17 days right now? We're not sure. Could it be up to 28 days? Is there, everybody's different?
Everybody's different. And I even have a patient who was sick 4 weeks ago and is still IgM positive. And I have a patient, this was the latest one from today. She was in Paris, February 1, got sick, and only is IgM positive right now. So she's never converted over to IgG. And I talked to the rep about it and everything. I'm like, do you know, have you been seeing this? And she said they've actually been seeing this with this virus. And there's a possibility that this person might be able to be reinfected because they haven't converted to IgG, which is that full memory. And so that person might want to be a little bit more careful, because even though she's had it once, doesn't mean she might not be getting again because she hasn't converted. And she may have something going on in her immune system other than just COVID that might not be allowing her to convert. And that's a good, important information to know, because that's something I could help with as a provider, as let me tee up your immune system to maybe let's get you to go to the other side, or prevent, help aid in the not transmitting again. So that's why I think
as a functional medicine doctor, that's what you guys are known for.
Yeah.
So, okay, so that's maybe why people are testing positive the second time later on as well, because they still have that IgM active in their body. Okay, good to know. Thank you for.
And I was going to say one other thing that we are still unsure of, that is, we're learning, we're babies in this whole process. Everybody is. So since there is an L strain and an S strain, the S strain is really more of it, like I like to think as safe in the sense where you're more homebound, you're not headed to the hospital. And then there's the L strain, which is, I think, as lung, and you may be on a ventilator. And that's the more caustic of the two. And so if someone gets an L strain versus an S strain, can you reinfect with one versus the other? They look relatively the same on the antigen receptor, but this is where mutation can happen in the future. And just because you're immune now doesn't mean you're going to be immune next summer or next winter, kind of thing. It could mutate just enough, or you might have had the opposite strain, so you may be able to get it with the other strain. So still to be determined.
And the wild thing is that, yes, 80% of the population that comes in contact may be asymptomatic and not really show any signs, where 20% may have to be hospitalized, 5% may have to be ICU. And then what the doctors are saying, and we're working with TRT, tissue regeneration technology, we're actually on the front lines with some of these other providers at the First Hospital in Seattle, and they're showing 23% of the patients who suffer from COVID-19 are actually having myocardial issues afterwards. So
Yeah.
23%. So that's a big, like, it just isn't, this virus affects other organs than just your lungs. And we can have a whole separate one about the cytokine storm and how these actually bind with the ACE2 receptors in the lung and actually damage the, is it the endothelial type 2 tissues that creates surfactant. So we may do another one on that, but I like where you're going with this, and please keep going.
Yeah, and I was going to just tee off on you in that one little respect where people, we saw tons with SARS that people were getting cardiomyopathy 10 years later. And so when you have a virus, I don't want you to ever think that you get a virus and then you're immune and you go about your happy life and you're never going to have a problem again. But viruses can be advantageous and come back up whenever you're down and weak. And with this specific virus, we're also seeing an elevated level of your liver functions. And so people are having these kind of viral hepatitis storms. And so are we going to see liver issues 10 years from now where people are getting fibrotic liver disease and, so forth? So I think we need to keep an eye on it. And I also think that's why antibody testing is important, because maybe you could work with a functional medicine specialist that could help you lower viral loads now and really boost up your mitochondria and so forth. So I think that's why it's also really important, is because even though you've had it, doesn't mean that you're going to be great for forever. So lastly, IgA, this is what's really specific for Vibrant, this specific test that I'm talking about, is no other antibody test currently on the market is doing IgA. And IgA is an important antibody because this is really what's in your mucosal surfaces in your both gut and lungs. And, some people will only present with diarrhea. And it's really because the COVID has seeded in their colon. And this is a specific antibody for those. And I think you do a disservice if you test for antibodies and then you don't test for IgA, and maybe the person only had IgA positive. So then you totally miss and you'd have a false negative. So this is one area that they do better with. And they also show that they're both 97% sensitive and 98.3% specific. So specifically telling you that you have COVID, they know for 98% chance that you have COVID and 97% sensitive to not having false representation.
That's important. And this is the reason why I wanted to bring you on, is because you're working with one of the few labs that has testing all three. Most of them I hear about the IgM and the IgG, and you're the first one. So one of the reasons why I want to bring you in.
So let me show you a couple of tests here. And so this right here is a sample. This is what would look like if you were completely negative. So these are the antigens. This is remember, that's a little signal. And then these are the antibodies. So this person thought they had it, but maybe had influenza or something. So totally negative. But this one, you see that you still have IgM positive, you have an IgG, so middle of infection, starting to convert over, had no infection in the mucosal lining. But what's interesting is there's an FDA approved test right now. It's a company called Celix. I have nothing against them at all, but they only test for the nucleoprotein. So if she had done that test, she would be completely negative, correct? So if you don't look at the spike glycoproteins, you're gonna miss it. So same thing with receptor binding domain. There's another test that is just doing these two, and again would have missed this. So this is why it's important to do all four. And this patient, this is my patient that I was telling you about that works in a care home for, she has a 103 years old woman who she cares for, and she's really scared that she's going to transmit, and I can't safely send her back with complete IgM positive across the board. I can't say that you're still not shedding, and she also has IgA, so the possibility that it's still in her mucosal lining, I can't send her back with good conscience. And so working on her immune system to hopefully get her to convert. So I think this is really powerful to realize that you really need to, if you're going to get antibody testing, please ask them the antigens and the antibodies. You don't want to miss either one, because I don't know if you can fully feel safe in the actual dissemination of what your results were, that you're like, oh yeah, I'm completely negative, yay. And then you may have missed the whole complete area. So.
And for the caretakers, it's huge. And so many people out there,
And
they rely on those front
work.
lines.
Yeah, I mean, we need healthcare workers back in the workforce. And if they've been sick and they've got antibodies now, guess what? Go back to work, and you may need a little less PPE, and you may not. I mean, I want everybody to have, the standard PPE, but maybe you don't need to be as crazy with, full on beekeeper hood and so forth, because you have antibodies. So I think it's really important for us to be able to, how we can get our economic crisis, like everybody back into the workforce and doing their thing, and feeling reassured that they can do it, and that they're not going to infect people and so forth. So I think that this is kind of our next staging. And I think it's also going to help us in our research of how many people actually have been infected, because there's so many that think they're like, oh, I was sick in February, but I'm not sick now. Did I have it? I mean, really helps us with the count, and helps us for further, because there will be another pandemic, but this helps us be able to be more prepared next time.
And you make a great point. Those patients, those early people that were infected who get through this, and thank God, without any damage, they're the ones that are going to help re-stimulate our economy. And yeah, so important. And honestly, I have 2 family members here in Atlanta that have gone through it. They were putting off testing after 17 days. Thankfully, our clinic was able to get 5 to 10 tests per week, and we were able to test our healthcare members, but also we're able to go out into the community and start testing people, so they knew, right? And then they could quarantine and really stay under. But the important part is they get back into society. We've got to be having these tests available.
Yeah.
And you make a great point. And I hopefully there's enough, because this is going to be almost as important as the frontline tests.
And if they don't feel up to par after they've had it a couple months down the road, maybe there's some work that they need to still do on their immune system to really get them back up, and they would know, hey, this is what I had. Can you help treat me and get me, running back and getting everybody functioning on all levels again? So yeah, I do think it's important to know. And then there's also the convalescent therapy, which is this kind of, it dates back, I believe, to 1819. We're giving small doses of a certain virus to help build up antibodies, basically kind of like a herd mentality, in the sense where you get a little bit, and then you have antibodies. So people that have had antibodies, they can actually donate blood, and they take the plasma out, and they can actually help this treat other patients with this, so that they don't have to have as bad as effects from it. So I think, if you want to donate and so forth, find a place within your region that is doing the convalescent therapy, because it is very helpful, and they're showing it to be that people are getting much better using it. So
great information. I love it. And I know it's going to help both of our communities understand this a lot more. Yeah. Last, and I love following you on Facebook. Give a shout out to your integrated clinic, please.
Yeah, so Edge Integrative Wellness. We're on Facebook, we're on Instagram. I believe we're even on TikTok. So yeah, you guys check us out. If you guys have any questions about this, really good about getting back to you. I do videos every Sunday night at 5 p.m. Mountain Standard Time. I do talk on COVID. So if there's questions that you have, I do my best to give you the latest and the greatest that's out there of reliable information, research-based. And if you have any questions about functional medicine, we do treat all across the country, so we can do telemedicine anywhere. If you are looking for a functional nurse practitioner, then I'm your girl.
You really are. And you have a wonderful virtual platform and clinic. And so I know you're helping lots of people across borders.
Yeah, so we are so blessed here. Oh.
Last but not least, I guess, the mask thing, right? To mask or not. I mean, we're a few weeks back. We've had the masks, and thank you, in our clinics for 6 weeks. One of our partners is a pulmonologist, and he was way in front of this, Dr. Frank Cook. And a shout out to him. But he said, listen, we have to see patients. We're an essential clinic, but we also have to to really think that we are a carrier and the people we're coming in contact with are carriers. So let's protect as much as we can the surroundings that we can control.
Right.
So,
You wearing the mask really is you protecting other people from your secretions, basically. It's not really protecting you. It's protecting other people from you. Although, you know, it is aerosolized and it can go into the mucous membranes and everything else. But I like people using masks, but I like to also bring home the point that if you're not used to wearing masks, you will touch your face. And if you have contaminated hands, it's now on your mask. So masks have to be very single use only. They can't be you wear them all day long. You've been in and out of your car. I see this one in the car all the time. So you have touched it how many times, and are your hands clean? That is, I can't bring it home enough, is that you got to be careful about your hands and touching your face, because the mask is going to inevitably have something on it. And if you're using all the really fun designs and so forth, please wash them daily. So have a few of them. And if it gets moist at all from your breath, change it out. So that's, I really want to bring that point home, that it can be a little cesspool. And if you throw it on your car seat, guess what? It's on your car seat. So you gotta, so protect your family and people around you, and try to decontaminate where you can.
great points. Thank you so much. My best to
welcome.
you and your family out there.
Yeah.
Please be safe, and love to have you in future episodes to be our resident COVID-19
You're so welcome.
specialist.
Thank you. Appreciate
Thank you so much. Be great.
Take care.
Okay.